It's always a pleasure to be here. Thank you so much, Mitch, for inviting me. And it's also a pleasure to be the last speaker before lunch. So bear with me. I think what I have to share with you is going to be very interesting for you and also very synergistic from what we've heard earlier this morning. Some excellent speakers this morning, some great ideas, and I think the topic of patient-centric marketing really fits well with that. So I think patient-centric marketing can help improve communication, not only with patients, but also with doctors, and also with your own employees. I think it'll improve engagement. It can help in appropriate use, loyalty, and of course, it's going to help your company's financials. So, but first, what is patient-centric marketing? And if you'd quickly vote, we'll look at what you think patient-centric marketing is. Please vote. Very good. This was a poorly engineered question. And you're right, it is actually 2 and 3, and I think probably 3 is probably the one I favor personally, but 2 could also be right. So it is really knowing the patient journey and really helping patients deal with that journey. Let's talk a little bit more about that. You know, as we heard this morning, when you get the diagnosis of cancer, it is really a shock. And I'm sure what we heard this morning, and we've probably heard from other people we know, is you go through all of these motions shown here. You know, imagine, if you will, we had a speaker at a meeting we had a few months ago where the speaker tried to walk us through what it would be like for a patient to be told they have schizophrenia. And it went something like this: "Sir, the woman you think is your wife is not your wife, and if you approach her one more time, you will be put in jail. Outside right now, there are people from security, and if you refuse to take your medication, we're going to have to try and do something about this." And there was silence in a room of 400 people, all who know CNS very well. I don't think any of us ever really thought about what that patient journey is like. And of course, I'm sure anyone who gets a diagnosis that's catastrophic or tragic or difficult is going to really have a challenge in front of them. But even some of the more simple ones, if there are simple medical conditions, I probably doubt that there are, have gone through all of these things. And we really, as an industry, as a pharmaceutical industry, we need to help try and understand that deeply so we can help people with that. So I'd like to ask you now, if you would, when should patient-centric marketing be used by a pharmaceutical company? Please vote. Definitely music appropriate for the question. 94%, all of the above, absolutely, you got it right. I think many people don't see it that way. I'm glad to see this group does. It's something that can be done very early in the research stage. We've recently had a number of compounds that have gone through research where we started to incorporate patient input into the research process to make sure we're asking the right questions, that we're doing the right kinds of studies, getting the right types of outcomes so that we be more meaningful for the patient. So yes, all of these things, pre-launch, launch, growth, maturity, even post-LOE, if you have good customer loyalty because you've been communicating well because of patient-centric marketing, we think you can hang on to more of that business down the road. We also think it's going to help with discussions with doctors to try and make sure they have the right language to communicate well with patients, and furthermore, help with the discussions with payers so that they see the true patient benefits and they know that what patients are going through. If they understand that more deeply, they can realize the value of what you're offering. So sometimes I think in pharmaceutical companies, and I know we struggle with it at Lundbeck, we don't understand that patients are actually people. They have a life. They're dealing with crying children. They have to get to work, and they really can't take the time to deal with some of our treatments. And we hear that, and we see that in the adherence that was discussed earlier about some of the medications that we work with. People don't have 4 hours to sit in an infusion clinic. Is there a better way to do this? Can we make it 1 tablet instead of 3 a day? Things like that may sound simple, but it's going to make a huge difference in adherence and helping that patient walk through the patient journey. So another question for you: how many workplace disability claims are related to mental illness? Please vote. I can see some of you did look ahead. Okay, that's fine. 1 of 3 is right. 1 of 3 disability claims, workplace disability claims, are related to mental illness. Now, out at the break, a number of us were talking, and somebody said something, well, patient-centric marketing is something we move to when we really need to. And unfortunately, I have to admit, this was the case at Lundbeck. We were in a situation with one of our medications, we were having a very difficult time getting access. And we really had to take another look at the market. And we looked at the workplace part of the market as one where people would realize more value by reducing the amount of absenteeism and presenteeism. That was very valuable for the private payers. So we were trying to get to outcomes that really matter to people, and outcomes that matter not only to patients, but also to payers and to employers. Imagine, if you will, the importance of being able to deal with your depression, to be able to think and function normally, especially in this knowledge economy that we live in. So very important, and this really struck a chord with many psychiatrists, general practitioners who are treating depression on a daily basis. So this was very, very successful for us, and it allowed us to, deal with some of these issues, help patients and doctors deal with issues of absenteeism and presenteeism. So it allowed us to make Cipralex the fastest growing product in Canada for a couple years in a row. It was value show leader. And it also gave us the opportunity for Lundbeck Canada to be the fastest growing company. So we're very, very proud of that. And I think it's a good example of where patient-centric marketing can be very valuable. So what we've heard in this very, very brief discussion is that patient-centric marketing, really putting a focus on that patient journey, can help in brand recognition, company recognition, brand uptake, adherence, loyalty, and value. So with that, I think we've talked about the patient journey. Hopefully, we can better engage and inspire with patients and with doctors and add value to what we're offering to people. Just want to thank you for this opportunity and turn it back to your host.